Good day, viewers. Eko Blog is reporting live from Odi-Olowo, Ojuwoye, Ilupeju, Lagos State, Nigeria, where Eko Club International, in collaboration with Eko Club Atlanta, is beginning its 3-day medical outreach. Eko Club International is an organization for Lagosians in the diaspora, and Eko Club Atlanta is a chapter member of Eko Club International. The outreach, scheduled to take place from November 3rd to 5th, will feature medical services including health education, basic health checks, eye check, dental health care, and general health care. This initiative aligns with the goals and objectives of the organization, which aims to provide a positive impact in the community. Stay tuned as Eko Blog brings you live coverage of the event as it unfolds. I'm Susan Omolayo, reporting for Eko Blog.
On Monday, November 3, 2025, the Odi-Olowo Ojuwoye Local Council Development Area in Ilupeju, Lagos came alive with medical activities. Residents, both young and old, gathered in large numbers to witness the kickoff of a transformative 3-day medical outreach spearheaded by Eko Club International in partnership with Eko Club Atlanta, marking a significant milestone in community healthcare delivery. Also in attendance were the Executive Chairman, Honorable Seyi Jakande, members of the Council Association, representatives from both Eko Club International and Eko Club Atlanta, and the medical team. The outreach reflects a shared commitment to quality healthcare and community empowerment. Eko Club International, an organization for Lagosians in diaspora and its Atlanta chapter, together with Honorable Jakande, united to improve community wellness and general well-being. Leading the initiative were Honorable Dr. Lola Ogbara-Olugba, Honorable Wumi Isioton, and Honorable Deji Ajiboye, working together to improve community wellness. The event commenced with a press conference bringing together key stakeholders including Honorable Seyi Jakande, Honorable Deji Ajiboye, members of Eko Club International, and local council representatives. In his address, Honorable Jakande praised Eko Club Atlanta and Eko Club International for their unwavering commitment to improving community health. He announced that the outreach would provide medical services to approximately 1,000 residents, emphasizing that the initiative is designed specifically for the core residents of Odi-Olowo Ojuwoye LCDA. He reaffirmed that the program aligns with his administration's EWA agenda, health, education, water, and agriculture, a strategic plan to uplift the community. Honorable Jakande highlighted the pivotal role of Eko Club Atlanta in actualizing this vision, enabling the council to deliver essential healthcare services to those most in need.
This initiative is designed to cater for all residents of Odi-Olowo Ojuwoye Local Council Development Area. And this will happen in just one day. Of course, a monumental task, and this speaks to our commitment in bringing the accessible healthcare to those who need it most, as spelled out in my EWA agenda. This is part of the reason we have partnered with the Eko Club Atlanta in order to bring our plan to fruition. We believe that healthcare should be within reach for everyone, and today marks a significant step in making that a reality. Leading this incredible mission from the Eko Club Atlanta team is the dedicated Alhaja Wumi Isioton, whose passion for serving is truly commendable. We're also proud to have with us Dr. Olabisi Jagun, a physician with a number of years of experience, along with Dr. Nike Agbe, a skilled pharmacist, all from the United States of America. Together, they represent the expertise and dedication that will guide this medical outreach team. The head of the team is Honorable Deji Ajiboye. What should be expected from this medical outreach? We will be providing a diverse area of free medical services to our community, which will include complete medical examination with experienced medical professionals, ensuring personalized attention for each participant. There will also be medical distribution for those who require it, so that no one leaves without the resources that they need. The medical health screenings will help identify potential health issues and, of course, promote preventive care. The educational health talks that will empower attendees with knowledge and about their health. This event is not just about treatment, it is a proactive approach to promote well-being and health literacy within our community. We are eager to educate, inform, and help our residents understand how they can take charge of their health. The core benefits of this medical outreach to our community members are numerous. It will provide access to quality healthcare services, reduces the burden on our healthcare system. It will empower community and all residents with knowledge about their health and enabling them to make informed decisions. Identify potential health issues very early while promoting preventive care and reducing the risk of complications. Foster a sense of community and social responsibility as we come together to support one another's health and well-being. As we commence this outreach right after this press conference, I encourage everyone present to take advantage of this remarkable opportunity to receive quality health care right in our community. Also note that we'll be taking this mission further. We have plans to take our medical outreach to every single ward within our local council development area. In closing, let me express my heartfelt gratitude to the Eko Club Atlanta for their unwavering support in bringing this initiative to life. Together, we are working hand in hand to build a healthier and informed community. I thank you all for your time, and thank you, and let us make this medical outreach a tremendous success for everyone that is involved.
Chairperson of the Medical Mission Outreach, Honorable Wumi Sultan, welcomed attendees and emphasized the shared commitment to making a positive impact in community health. She announced the rollout of the 3-day healthcare initiative across Lagos State, beginning in Odi-Olowo, Ojuwoye, and reaffirmed the mission's goal of reaching underserved communities and improving public health across the state.
Today, we, the members of Eko Club Atlanta and our dedicated volunteers, gather with a shared commitment to improve healthcare and well-being in our communities. Our medical mission outreach is a beacon of hope for those in need, and we are honored to have you all here to witness its kickoff. Over the next few days, our team of dedicated medical professionals will provide critical healthcare service to thousands of individuals in Lagos State. Starting with Odi-Olowo, Ojuwoye today. Tomorrow, November 4th, 2025, will be hosted by the Executive Chairman of Ojuwoye LCDA, Honorable Segun Odunbaku, at the NIJ compound in Ogba. On Wednesday, November 5th, we will be crossing over to Lagos Island to continue our outreach at the Elegbata Sports Complex, graciously hosted by the Iyalaje of Olowe Market, Okearin, Rotarian Chief Mrs. Ogundele. I would like to extend my deepest gratitude to the Executive Chairman, Honorable Seyi Jakande, for partnering with us, and to all our other sponsors, partners, and volunteers. Your support made this mission possible. To the people of Lagos State, we are here for you. We listen, care, and provide the best possible treatment. This mission is about building relationships, fostering trust, and creating a healthier future. Join us on this journey of compassion and service.
Honorable Deji Ajiboye, President of Eko Club Atlanta, commended the Executive Chairman for his leadership and commitment to the community, noting that the partnership between diaspora-led organizations and local councils is crucial to addressing healthcare gaps.
The model for Eko Club Atlanta is simple: service to humanity. This is what we do every time. So it's always lying in our heart to bridge the bridge between the community and between the state governments and our people. So this is always what we do every time.
Residents of Odi-Olowo Ojuwoye expressed heartfelt appreciation to the organizers, Eko Club International, Eko Club Atlanta, and the local council. They spoke of the significant impact the initiative has had on their health and well-being, praising the value of receiving free education, medical treatment, and health screenings. For many, the outreach was a timely and transformative effort that addressed critical healthcare needs within the community. The event ended with fulfillment, gratitude, and interviews, setting a reassuring tone for the days ahead and reinforcing a shared commitment to accessible healthcare and community empowerment.
Mo dúpẹ́ gidigidi gan fún nǹkan tó ń ṣe yìí o, mo dúpẹ́ gidigidi gan ni because wọ́n máa ń pòwe pé ṣàṣà ni wọ́n ní kéèyàn wá jẹ sàárà ẹni ṣé omi la ní kó mú wá ni àbí kí la ní kó mú wá, a dúpẹ́ lọ́dọ̀ Ọlọ́run.
A dúpẹ́ torí pé wọ́n fún wa ní wọ́n yẹ̀ wá wò ọ̀fẹ́ pé fún ìlera ara wa àwọn àǹfààní tá a ti jẹ bí ó pọ̀ fún ìlera ara wa. Ọlọ́run àwọn tó yọ̀ǹda bẹ́ẹ̀ tó ń ṣe irú ètò yìí Ọlọ́run àtúbọ̀ máa gbọ́wọ́ wọn sókè, kò dẹ̀ ní rẹ̀ wọ́n o, àní wá wọn tì ní Nàìjíríà o, wọ́n túbọ̀ máa mókè sí o.
Àǹfààní tí mo jẹ́ ń bíbélì lónìí pé mo wá fún ìtọ́jú nípa ojú àti àwọn àìlera míì, so mo rí pé ó wà well organized, wọ́n organize dáadáa, àwọn èèyàn tó wọ́n dẹ̀ jókòó sí orí àga, so a gba nọ́mbà, so àwọn nǹkan tó kàn kù ní ìsìn ni pé ìjọba Odi-Olowo ní bíbáyìí wọ́n gbìyànjú pẹ̀lú Atlantic pẹ̀lú àjọṣepapọ̀ tí wọ́n ṣe, so kákan gba oògùn ká dẹ̀ gba glass, àwọn nǹkan tó kù nìyẹn, so wọ́n ní ká dúró síta fún àwọn nǹkan míì tó kù, so àti rí àwọn dókítà. Tí mo ní láti sọ fún wọn ni pé wọ́n gbìyànjú, Ọlọ́run máa ràn wọ́n lọ́wọ́, so irú àwọn nǹkan báyìí náà ni à ń fẹ́ lọ́dà democracy, kó wọ́n pé a bá nídìí ìrànlọ́wọ́ pé fún àǹfààní ká máa rí gbà, kó má di pé gbogbo nǹkan owó bìkọ́ bí ìlú ṣe rí nǹkan wọn, so kò yí sí láti máa ní o fẹ́ ṣe lé o fẹ́ ṣe lé kó tó sanwó lé kó tó sanwó gbá kó tó sanwó head, gbogbo ẹ̀ ó nira lágbègbè, so àti ìtìwọ̀nba tí wọ́n ṣe náà àǹfààní ló jẹ́ fún àwa aráàlú, so dà á mọ̀ pé democracy tá a wà yìí à ń jẹ́ àǹfààní ìjọba democracy.
Ètò ìlera yìí ó wà òkè gan-an níbi pé tó bá ti ń wọlé síbẹ̀ ìmílẹ̀ tó bá ti ń wọlé tó ti ń kan náà iná tí wọ́n máa dá yín lóhùn lẹ́sẹ̀kẹsẹ̀ tí wọ́n máa gbóògùn. Èmi ń sìn mo ti gba ìgò mo ti gbóògùn gbogbo nǹkan tó ń ṣe mí lára mo complain fún wọn, wọ́n dẹ̀ ṣàlàyé gbogbo ẹ̀ wọ́n dẹ̀ ṣe gbogbo ẹ̀ fún mi lẹ́sọ̀ tí mo fi jáde ń sìn. Láti dúpẹ́ lọ́wọ́ wọn torí pé àwọn Yorùbá máa ń sọ pé ìlera lògùn ọrọ̀, wọ́n ṣe wá bá wa ṣe léyìí kí ṣe gbogbo èèyàn kí gbogbo ìlú náà ló wà ń bí lé ní báyìí sìn. àá fẹ́ kí kán tún jọ kán tún try pẹ̀lú àjọṣepọ̀ Odi-Olowo Ojuwoye Local Council Development Area kí wọ́n tẹ̀síwájú nínú ìrànlọ́wọ́ tó ń ṣe fún àwọn aráàlú torí ìrànlọ́wọ́ ni ọ̀pọ̀lọpọ̀ ní olè gbogbo oògùn tí olómìn gbà ń bí lè ní àti glasses kí gbogbo èèyàn ló lè avoid láti rà ṣùgbọ́n bó ṣe ṣe eléyìí náà nǹkan tó dáa púpọ̀ fún gbogbo ìlú ni kán bá wa tẹ̀síwájú lórí ẹ̀.
It's been so good. I mean, like we've been coming previously, sometimes you have so many patients coming at the same time. For registration, it could be overwhelming, but we're up to the task because we have the experience. So we know what to expect when they come. Sometimes some are very impatient. They want to see the doctor. I don't blame them. Some have not seen doctors for years. So we try to reassure them that they all will be seen, and if there's a need to follow up with their doctors, they were advised.
Eko Club International, we've been giving back to the community for a long time. And we are with Eko Club Atlanta. Eko Club Atlanta is part of Eko Club International. So they're trying to give back to the community like we always do.
Oh, I'm so happy. You know when you lead something and it's successful, you'll be full of joy. I'm so happy and excited. It's been fun. The motivation is when I help people, we like to help people. Eko Club Atlanta, Eko Club International, we love to help people. That's why we are here.
I'm so happy, I'm always looking forward to reaching out as we always do. I'm in Eko Club, so it's an opportunity for me to show my appreciation to God that gives me health, to be able to reach out to give back to the community. This is ECI, Eko Club International, in collaboration with Eko Atlanta. So Eko Atlanta already had an appointment with Odi-Olowo local government. So that's why we took the first date to come here.
In actuality, we try to take it to everywhere in Lagos State via Lagosians. So we try to go, but what we normally do, we look for a partnership at first. And the chairman was so magnanimous and to cater for his own people by partnering with Eko Club Atlanta, and that's the reason why here is our flag off, and we'll be here, to attend to people today. So this is like the 4th one. We normally come every 2 years. Every biennial, we are always here in Lagos. And the last time we came, we were at 5 locations. So this time around, it's going to be 3 locations. In Nigeria, this is what we do. Back in the United States, we partner with Hosea Feed the Hungry. We partner with Martin Luther King Day, whereby we go to elderly people's home and help them to rehabilitate their homes. So many things that we involve in a lot of things that we normally do. But here in Nigeria, we just bring the medical mission because we know so we try in a way to impact our people in a positive way. Like I said, we do know there's a lot of people that need help. But like I said, we're go into 3 locations. Tomorrow, we're going to be at Ojuwoye. Wednesday, we're going to be at Elegba at Okearin in Lagos Island. So these are the ways we can do. And we do Eko Club International, which is the bigger body of Eko Club. They were here last year too. They were at about 6 locations. So we try to do it, try to mitigate the bridge between our people and the state government. The state government cannot do everything. So all I would say is to implore other organizations to do something like this, and it will go a long way to help our people.
One of our key principles in our agenda, our agenda, is the first letter, which is the H, which stands for health. In our mission to accomplish that agenda, in the health sector, we have deemed it fit, to augment and supplement our medical intervention with this kind of collaboration with Eko Atlanta. Eko Atlanta has brought in professionals, medical professionals from all aspects of medical fields, to Odi-Olowo. They arrived on Friday, and we've received them here immediately from the airport. So we feel that this kind of, we all know what medical tourism entails, just the cost of going overseas, traveling abroad, to get the best of medical health check. So what we have done is to bring this back locally to Ojuwoye, where we have assembled all our residents, cut across the gender, the aged, and of course people with fear that are living with disabilities, for all of them to come together and benefit from this medical tourism. We believe that this kind of intervention, will further, help our constituents, to first identify, what kind of medical, their medical status, which itself, we all know that when it comes to health, the prevention is always better than cure. So that aspect will be well taken care of with the complete medical examination that is taking place. And of course, they've come with a lot of medications, to support everybody that might have one medical disorder or issue. My advice to the residents of Odi-Olowo, is that which we continue to sensitize our people, that medical health, for us is something that they need to, pay attention to, identify what is wrong, have a complete medical checkup, and that is what has informed us as government, to completely eliminate, the cost of all medical examinations in all our PACs. We have started we have initiated a program where all of our PACs will offer completely free medical services to everybody within Odi-Olowo LCDA. Because our belief is that for every resident that patronizes our PHC, our initial step is for them to have and to pay a token amount, to obtain a card, which we believe that is the first step in having an health check. So what our government has done is to completely eliminate that cost, the cost of getting card, the cost of getting attention from our medical doctors have today been eliminated in Odi-Olowo LCDA. So all our medical services are completely free. Across all our AWA agenda, we have simultaneously worked across all of those letters, and all of those branches of our agenda, starting with health, which is part of what we are doing here. What we are constructing a primary health care center in Kayode, which we started with this administration. In terms of health, we have further, ensure that everybody within the downtrodden, especially people, that have, they are people with less funds and consider the economy, we have further eliminate any cost, that you can get all our medical services within Odi-Olowo at zero cost, And so as far as our health concerns, health interventions are concerned, we are extremely intentional about delivering health services to the people within Ojuwoye at no cost. This is a flag off for our medical tourism. From this, we are going to the wards. We are taking our medical tourism to each of the wards. So taking the health facilities to every person within the community. Across education, in the first of its kind, back to school program in Odi-Olowo. Our back to school program was tagged back to school and back to pocket. It's a 2-in-1 agenda where we have ensured that our back to school program commenced earlier than the date of resumption, which will save the parents of these kids or guardians from going to purchase all of the medicational materials before school resumption. So the traditional method of giving to students on day of resumption was eliminated, and we resumed, we adopted a new innovation, including starting off this educational intervention weeks before resumption. And what we have provided are all school essentials, from school, the school bag, all writing materials, And in our education, we have also provided what we call the Eko Club, which we commissioned some weeks ago. This is to ensure that, we have good nutrients, we have good feeding process for all our students within Ojuwoye. And all of these are, of course, completely free.
For Eko Blog, this is Susan Amalayo.
The first day of the medical outreach here in Odi-Olowo, Ojuwoye, Ilupeju, Lagos State, Nigeria has been very productive, with residents turning up in large numbers. This exercise reflects Eko Club International and Eko Club Atlanta's commitment to community well-being and access to healthcare. Thank you for staying tuned. Kindly follow us on all our social media platforms on X, Instagram, and Facebook at Eko Blog. Also, subscribe to our YouTube channel at Eko Blog. Susan Amalayo reporting for Eko Blog.